and really excited to introduce our next keynote from InterSystems. We have just a tremendous opportunity here from one of the global leaders, and certainly, if not the national leader, one of them in the what's happening right now in the ecosystem, which is this connectivity amongst all the different health systems. Lynda Rowe is a senior advisor for value-based markets at InterSystems and an SME in that area all over the country. Lynda, really happy to have you on board here and looking forward to your keynote. Thank you for joining us today.
Hey, really good to be here, Stan. Thanks, everyone. Glad to be able to join.
Perfect. And so, really what we are digging into today is a lot of what happened with the JP Morgan Healthcare conference last week and all the adjacent conferences around. Really, it's a festival, usually when it's in person, around Union Square in San Francisco. And the excitement around that and what you guys have learned when you're looking at all this virtualization of healthcare that's happening and the evolution in 2021. How do you see managed care playing a role in this shift to value-based care? You're one of the national experts in this area. How do you see this all playing together with the virtualization of care?
Yeah, it's pretty interesting because managed care had a really bad reputation back in the 80s, right? It was sort of under the Clinton administration. And so people think differently about, well, what is managed care? And managed care is really sort of the corollary to value, right? It's how do you manage a set of patients in a population under specific sort of cost and quality outcomes, right? You're looking for the right cost, the right quality. But it's really interesting because I think that the shift to value-based care is going to accelerate, and I'll talk a little bit more about that later. But what it's allowed providers, payers to do under these relationships is have freedom, right? So we have been able to liberate data because of a lot of the policies that have come out of ONC and CMS, and that's been awesome, right? Think about the fact that we now have more data than we actually know what to do with, which is a great problem to have. But being able to use that data to move the needle in value-based care, right, has been just enormous in our ability to do that.
That's fantastic. Absolutely fantastic. And when you look at what's happening, with this Medicaid side of the spectrum, right? So we've got obviously a population in need, unlike any other time in U.S. history during a pandemic, very difficult to get to the doctor. What role has Medicaid played in the COVID-19 response management that's happened?
Yeah, so I'm going to wear I'm the chairman of the board or past chair of a federally qualified health center. So we were totally and are totally on the front line of what's happening here. And so certainly the Medicare and the Medicare waivers have been a really important part of what we have been able to do as our response. So we've been able to improve our ability to use telehealth. It was something we were thinking of doing, and we're part of an ACO. We're part of a Medicaid ACO. Massachusetts has the advantage that we have broad rollout of different models of an ACO that are being piloted. And so our health center is part of that ACO. So we accelerated how we were doing telehealth. We started to do delivery of prescriptions. We are doing all kinds of innovative things around our care model. But I would say the nicest thing is that both our state and our ACO actually provided us with additional funding to combat the pandemic. And we've integrated into the EHR information about COVID and about which patients are highest acuity, most needy, most needing access. And one of the things we're also talking about is how do you deliver? Because think about who our population is, right? What if you need a telehealth visit and you're in a rural community or a community that just doesn't have access to the kind of resources you need? So we've been delivering tablets, right? We've been bringing things into the home. So, you know, remote monitoring, right? The blood pressure cuff and all that stuff, and helping to give access and instructing our patients on how to give data back and how do you then collect that data and put it into the medical record when they physically can't come in. So I think that, you know, Medicaid through the waivers and through some of these innovative ACO models that some states have really helped accelerate how we can manage these underserved patients, Dan. So it's just been enormous, enormous benefit. And like I said, our ACO actually, you know, gave us a loan so that we actually had the funding, because clearly we weren't doing fee for service anymore. We couldn't see patients and get that funding. And so that's a really important point about that shift to value-based care. We see this as a tipping point, and you know, nationally, that providers have started to realize that when patients can't walk in the door, that going to a capitated or a per member per month model to help them do all these innovative things I was talking about under that PMPM is really the opportunity we needed to move to value-based care, because fee for service dried up revenue across the board.
Yeah, no doubt about it. It's just incredible how that's been so affected. And again, I think the opportunity to you know, have more clinical interoperability is more important than ever today. What are your thoughts about where clinical interoperability goes in 2021? Lynda, you're on mute.
Sorry. So our digital economy has just expanded enormously. So we've been fortunate that both in the private sector and in the public sector, the need to share data and move data has become an imperative. And the use of FHIR, for those of you who aren't familiar, which is the new, you know, standards that are now being used by provider organizations, by payers, providing access. Here's the cool thing: giving digital access to patients through third-party apps, using FHIR as a standard, data coming from initially payers, then from providers. That's going to make a very different economy in terms of me having control over my information, interoperability, moving that data. But I think the other opportunity, Stan, is that we need to clean up that data. The data that's coming in is just not, you know, easy to manage and easy to work with, because it often emanates from systems where that's not the purpose, right? If I'm a clinician and I'm documenting in a record, my purpose is not to create this pure set of data, right? My purpose is to document care. But ultimately in this digital economy, whether it's through analytics or natural language processing or anything like that, you need actually good, clean data. And that's one of the things we help to do, is to clean it up so that when it's used by those analytics, by that patient, by that provider, it's really usable and actionable. And I think that's one of the things that our digital economy's got to get better at, is getting data that's actionable.
That's fantastic. Yeah, absolutely. And I think now more than ever,